Arrhythmia means it's any abnormal beating of the heart. Okay, the abnormal beating can happen because it's slower, or it can be faster, or it's irregular. The irregular is the most common form, which is what we call atrial fibrillation, and that is the most common arrhythmia that we deal day in and day out. If it is a slower heartbeat, and if you don't have any symptoms, you don't need any treatment. If you have a slower heartbeat and you have symptoms like passing out, dizziness, or weakness, tired, you cannot do your daily activities, then we consider putting a pacemaker. Pacemaker is a minor surgical procedure. You come up during the daytime or come during the day and you do the procedure, you stay overnight and we send you home the following day. If it is a faster, we need to know what type of faster heartbeat you have. Because as I described, there are several ways that it can happen, having a short circuit in the upper chamber in the different areas. So we offer you an EKG, Holter monitor, or even monitor, or even place a small device called a loop recorder that sits in front of the chest and that stays for years and years. Because if you come and tell me that I have palpitation but that doesn't happen on a daily basis, it happens 1 or 2 times in a year, then we cannot ask you to wear a Holter monitor or even monitor forever. So in that case, we'll offer putting a small device that sits in front of the chest that records all the time throughout. So until we make a diagnosis, we just keep that device in the chest. So once we make a diagnosis of what type of a fast heartbeat you have, by looking at the monitor, looking at the EKG, we'll have pretty much an idea where it comes from. Then we offer electrophysiology. If you don't have any symptoms, again, you don't need to treat it. If you can control those symptoms, then fine. If you cannot control, then the first step would be to offer medications. If medication doesn't help, then we'll take to the next level where we offer electrophysiology study, where we put the catheters. Again, that is a one-day procedure. You come in the morning, you put the catheters that goes through the groin vein. And the catheter is located in different parts of the heart. Then try to find out how your electrical heat is going, and then exactly pinpoint where the short circuit is. And that sitting itself, we do the ablation therapy, and that ablation therapy mostly cure the patient. That usually takes care of non-lethal arrhythmias. But if it comes from the lower chamber, that we know by doing a Holter monitor, or we don't need an EP study for that. The EKG itself will tell us clearly whether it's coming from the upper chamber or the lower chamber. And if we know it's coming from the lower chamber, then the next step is to assess your pump function. If your pump function is bad, then we'll offer a defibrillator. Defibrillator is just a device that sits in the chest and gets activated when it needs to be. It doesn't improve the pump function, it's just a device that sits there and helps you when you're in problem. And we'll also give you medication to improve the heart function that may prevent the arrhythmia coming from the lower chamber.